over 90% of women with PCOS have abnormal ovarian androgen production. So that's really a hallmark, right? About 50%, so half of women with PCOS have insulin resistance, obesity, or an excess of luteinizing hormone. The key factor here is that ovulation gets interrupted because of, the hyperandrogenism, like excessive production of the androgens, anovulation, or, absence of ovulation is one of the features of polycystic ovarian syndrome. How does polycystic ovarian syndrome look like? So you can have skin changes, you can have changes at the level of the ovaries, and you can have other metabolic changes, right? At the level of the skin, what are the changes? So, although acne is common in adolescent girls or adolescents in general, about 60% of ladies who have PCOS have acne. The next thing is hirsutism. So hirsutism is simply abnormal amount of sexual hair usually appearing in a male pattern. Another thing you could take note of is alopecia, so hair loss, and it's hair loss actually. It can actually be male pattern hair loss or female pattern hair loss. So at the level of the ovaries, what changes can you see? So polycystic ovaries. So, and a cyst is simply a fluid-filled sac appearing in an organ or body part where it's not supposed to be. So you have cysts on the ovaries. So that's really a hallmark of that's a main feature of polycystic ovarian syndrome, as the name would suggest. To have an ovarian cyst does not mean that you have polycystic ovarian syndrome, right? Because you have things like functional cysts. You can't rule out PCOS based on the fact that you don't have hirsutism, for example, or acne or other features. Still at the level of the ovaries, you have anovulation, right? So if the ovarian cycle is is disturbed, then what else can you have? So you can have amenorrhea or oligomenorrhea, so like complete cessation of menses or scanty menses, right? And as a result, you can have infertility. A lot of times PCOS is associated with insulin resistance and obesity, and insulin resistance can lead to what? It can lead to acanthosis nigricans, which is some characteristic rash or lesions typically occurring in the axilla or on the neck. You can also have fatty liver. You can have metabolic syndrome. So metabolic syndrome is diabetes, obesity, and hyperlipidemia. What are the complications of PCOS? Of course, number one on the list is infertility, but what else? It's a risk for development of type 2 diabetes, especially with insulin resistance, right? There is a possibility to get diabetes type 2, sleep apnea, obstructive sleep apnea. I talked about sleep apnea in children in a previous video, so you can refer to that. I can make a video about sleep apnea in adults later on. It's a risk factor for endometrial cancer, endometrial hyperplasia. So hyperplasia simply means increase in the number of cells. So there's also risk for cardiovascular diseases. Do not forget depression, right?